Welcome to MCQs Master 101. If you're preparing for the NCLEX, pharmacology is one of the most failed sections, and today we're fixing that. In this video, you'll practice 50 high-yield NCLEX pharmacology questions that students consistently miss on exam day. We'll break down first-line drugs, dangerous side effects, antidotes, and critical drug interactions you must know to pass. Pause when needed, test yourself before each answer, and track your weak areas. Let's sharpen your clinical judgment and get you NCLEX ready, starting now. Question 1. Which medication is the first-line treatment for anaphylaxis? A. Diphenhydramine, B. Epinephrine, C. Albuterol, D. Hydrocortisone. Answer B. Epinephrine rapidly reverses airway edema, hypotension, and bronchoconstriction. Question 2. Which adverse effect should be monitored in a patient taking ACE inhibitors? A. Hypokalemia, B. Dry cough, C. Hyperglycemia, D. Bradycardia. Answer B. ACE inhibitors increase bradykinin, causing a persistent dry cough. Question 3. Which lab value is most important to monitor in a patient on warfarin? A. APTT, B. INR, C. Platelet count, D. Hemoglobin. Answer B. INR monitors the therapeutic effectiveness of warfarin. Question 4. Which medication requires monitoring for ototoxicity? A. Vancomycin, B. Ceftriaxone, C. Amoxicillin, D. Azithromycin. Answer A. Vancomycin can cause hearing loss and nephrotoxicity. Question 5. Which antidote is used for opioid overdose? A. Flumazenil, B. Naloxone, C. Atropine, D. Protamine sulfate. Answer B. Naloxone reverses opioid-induced respiratory depression. Question 6. Which insulin has the fastest onset of action? A. Regular, B. NPH, C. Lispro, D. Glargine. Answer C. Lispro is a rapid-acting insulin. Question 7. Which medication should be held if potassium is elevated? A. Furosemide, B. Spironolactone, C. Hydrochlorothiazide, D. Metalazone. Answer B. Spironolactone is potassium-sparing and can worsen hyperkalemia. Question 8. Which medication is used to treat acute asthma exacerbation? A. Salmeterol, B. Montelukast, C. Albuterol, D. Fluticasone. Answer C. Albuterol is a short-acting beta agonist for rescue therapy. Question 9. Which medication increases the risk of bleeding when combined with NSAIDs? A. Digoxin, B. Warfarin, C. Metformin, D. Levothyroxine. Answer B. NSAIDs potentiate warfarin's anticoagulant effect. Question 10. Which medication should be taken on an empty stomach in the morning? A. Metformin, B. Levothyroxine, C. Prednisone, D. Omeprazole. Answer B. Levothyroxine absorption is best on an empty stomach. Question 11. Which adverse effect is associated with long-term corticosteroid use? A. Hypoglycemia, B. Osteoporosis, C. Weight loss, D. Bradycardia. Answer B. Steroids decrease bone density over time. Question 12. Which medication treats atrial fibrillation by slowing ventricular rate? A. Dopamine, B. Digoxin, C. Epinephrine, D. Dobutamine. Answer B. Digoxin decreases heart rate by slowing AV conduction. Question 13. Which lab must be checked before administering heparin? A. INR,
B. APTT, C. Platelet count, D. Hemoglobin A1C. Answer B. APTT monitors therapeutic heparin levels. Question 15. Which medication causes a disulfiram-like reaction with alcohol? A. Metronidazole, B. Ciprofloxacin, C. Doxycycline, D. Clindamycin. Answer A. Alcohol with metronidazole causes severe nausea and vomiting. Question 15. Which adverse effect indicates lithium toxicity? A. Constipation, B. Fine tremor, C. Severe GI symptoms, D. Hypertension. Answer C. Severe GI symptoms suggest lithium toxicity.
Question 16. Which drug is contraindicated in pregnancy? A. Penicillin, B. Isotretinoin, C. Insulin, D. Methyldopa. Answer B. Isotretinoin is highly teratogenic. Question 17. Which medication is used to reverse benzodiazepine overdose? A. Naloxone, B. Flumazenil, C. Protamine, D. Atropine. Answer B. Flumazenil is a benzodiazepine antagonist. Question 18. Which medication requires monitoring of peak and trough levels? A. Acetaminophen, B. Gentamicin, C. Ibuprofen, D. Aspirin. Answer B. Aminoglycosides require peak-trough monitoring. Question 19. Which medication treats diabetic ketoacidosis? A. Oral hypoglycemics, B. Regular insulin IV, C. NPH insulin, D. Metformin. Answer B. IV regular insulin corrects hyperglycemia and ketosis. Question 20. Which drug can cause gingival hyperplasia? A. Phenytoin, B. Carbamazepine, C. Valproate, D. Gabapentin. Answer A. Phenytoin commonly causes gum overgrowth. Question 21. Which medication should not be crushed? A. Acetaminophen, B. Enteric-coated aspirin, C. Ibuprofen, D. Amoxicillin. Answer B. Crushing enteric-coated drugs destroys protective coating. Question 22. Which drug lowers LDL cholesterol? A. Digoxin, B. Atorvastatin, C. Propranolol, D. Furosemide. Answer B. Statins reduce LDL levels. Question 23. Which medication causes photosensitivity? A. Tetracycline, B. Penicillin, C. Vancomycin, D. Cefazolin. Answer A. Tetracyclines increase sun sensitivity. Question 24. Which electrolyte imbalance is caused by loop diuretics? A. Hyperkalemia, B. Hypokalemia, C. Hypercalcemia, D. Hypernatremia. Answer B. Loop diuretics cause potassium loss. Question 25. Which medication treats myasthenia gravis? A. Atropine, B. Pyridostigmine, C. Propranolol, D. Diazepam. Answer B. Pyridostigmine improves neuromuscular transmission. Question 26. Which adverse effect is expected with opioids? A. Diarrhea, B. Respiratory depression, C. Hypertension, D. Tachypnea. Answer B. Opioids suppress respiratory drive. Question 27. Which medication reduces gastric acid secretion? A. Metoclopramide, B. Omeprazole, C. Sucralfate, D. Simethicone. Answer B. Proton pump inhibitors suppress acid production. Question 28. Which drug requires monitoring for agranulocytosis? A. Clozapine, B. Fluoxetine, C. Haloperidol, D. Risperidone. Answer A. Clozapine can cause severe neutropenia. Question 29. Which medication is used for status epilepticus? A. Phenytoin oral, B. Diazepam IV, C. Carbamazepine, D. Gabapentin. Answer B. IV benzodiazepines stop acute seizures. Question 30. Which medication is contraindicated in asthma? A. Atenolol, B. Metoprolol, C. Propranolol, D. Losartan. Answer C. Non-selective beta blockers worsen bronchoconstriction. Question 31. Which drug is used to treat gout attacks? A. Allopurinol, B. Colchicine, C. Febuxostat, D. Probenecid. Answer B. Colchicine treats acute gout inflammation. Question 32. Which medication prolongs QT interval? A. Amiodarone, B. Digoxin, C. Lidocaine, D. Adenosine. Answer A. Amiodarone increases QT interval. Question 33. Which medication should be avoided with grapefruit juice? A. Simvastatin, B. Acetaminophen, C. Penicillin, D. Metformin. Answer A. Grapefruit increases statin toxicity. Question 34. Which medication is a potassium-sparing diuretic? A. Furosemide, B. Hydrochlorothiazide, C. Spironolactone, D. Butenamide. Answer C. Spironolactone conserves potassium. Question 35. Which drug treats hypothyroidism? A. Methimazole, B. Levothyroxine, C. Propranolol, D. Iodine. Answer B. Levothyroxine replaces thyroid hormone. Question 36. Which adverse effect is common with metformin? A. Hypoglycemia, B. GI upset, C. Weight gain, D. Bradycardia. Answer B. Metformin often causes diarrhea and nausea. Question 37. Which medication increases bleeding risk after surgery? A. Aspirin, B. Acetaminophen, C. Omeprazole, D. Ranitidine. Answer A. Aspirin inhibits platelet aggregation. Question 38. Which medication treats benign prostatic hyperplasia? A. Finasteride, B. Sildenafil, C. Oxybutynin, D. Tolterodine. Answer A. Finasteride shrinks prostate tissue. Question 39. Which drug causes red-orange urine discoloration? A. Rifampin, B. Ciprofloxacin, C. Vancomycin, D. Isoniazid. Answer A. Rifampin causes harmless discoloration of body fluids. Question 40. Which medication should be tapered, not stopped abruptly? A. Insulin, B. Prednisone, C. Acetaminophen, D. Penicillin. Answer B. Abrupt steroid withdrawal causes adrenal crisis. Question 41. Which medication treats Parkinson's disease? A. Haloperidol,
B. Levodopa, C. Valproate, D. Carbamazepine. Answer B. Levodopa increases dopamine levels. Question 42. Which adverse effect is seen with beta blockers? A. Tachycardia, B. Bronchospasm, C. Hyperglycemia, D. Weight loss. Answer B. Beta blockers may worsen asthma symptoms. Question 43. Which medication treats opioid dependence? A. Naloxone, B. Methadone, C. Atropine, D. Diazepam. Answer B. Methadone reduces withdrawal symptoms. Question 44. Which drug causes Stevens-Johnson syndrome risk? A. Lamotrigine, B. Lorazepam, C. Sertraline, D. Lithium. Answer A. Lamotrigine and cause severe skin reactions. Question 45. Which medication treats heart failure by reducing preload? A. Digoxin, B. Furosemide, C. Metoprolol, D. Lisinopril. Answer B. Loop diuretics decrease fluid volume. Question 46. Which medication is contraindicated with nitrate therapy? A. Atenolol, B. Sildenafil, C. Aspirin, D. Heparin. Answer B. Combined use causes severe hypotension. Question 47. Which medication causes extrapyramidal symptoms? A. Haloperidol, B. Fluoxetine, C. Diazepam, D. Clozapine. Answer A. Typical antipsychotics cause EPS. Question 48. Which medication prevents clots after orthopedic surgery? A. Heparin, B. Digoxin, C. Dopamine, D. Epinephrine. Answer A. Heparin prevents venous thromboembolism. Question 49. Which medication requires vitamin B6 supplementation? A. Rifampin, B. Isoniazid, C. Ethambutol, D. Pyrazinamide. Answer B. Vitamin B6 prevents neuropathy. Question 50. First-line treatment for luteal phase defect. A. Antibiotics, B. Progesterone supplementation, C. Testosterone, D. Metformin only. Answer B. Progesterone supports implantation. You've just completed 50 NCLEX Pharmacology questions most students fail. Great work! If you missed a few, don't panic. Pharmacology improves with repetition, patterns, and daily practice. Review drug classes, memorize key side effects, and always ask yourself, is this drug safe, effective, and appropriate for this patient? If this video helped you, like, subscribe, and share with a fellow nursing student. More next-gen NCLEX-style questions are coming your way right here on MCQs Master 101. Keep practicing, keep believing. You're closer to passing the NCLEX than you think.